Okay, dear students, today we're going to learn about the picture labeling for the first term. And this is the first video for the picture labeling. Let's go to the first picture. Here we can see the long bone structure, and in the labeling portion that we need to know about the long bone structures, in which we can say the two extremities, what we call them the epiphysis, and the shaft, what we can say the diaphysis. And we got here the spongy bone and compact bone part. We can also see here the epiphyseal line. We can see here that the ends are covered with the hyaline cartilage, what we call that articular cartilage. We can see inside the shaft here is the cavity, what we call that medullary cavity. And in the medullary cavity, this yellow color structure, we can see that is the bone marrow. Bone marrow, we have two kinds, red and the yellow. We got here the blood vessels, that is the nutrient artery. And we can see inside the medullary cavity, this wall lined by the endosteum, and the outside that is the periosteum, which one is attached here with the help of the sharpest fibers. These are some important points that you need to pay attention about the bones. And next we are having here the bone marking. It could also be important that to come in the exam, so pay attention on these bone markings. Here we are having the 6 kind of Cenoval joints. Those are present in the upper limb. So here we go, the ball and socket joint first of all, and between the head of the humerus and the scapular fossa, what we call that the glenoid fossa. And then we got here the hinge joint between the humerus and the ulna. We got here the saddle joint. Here we go to the example of the saddle joint, and between the carpal and metacarpal. Here we go to the example of the pivot joint between the head of the radius and the ulna proximally. We got here the gliding joint between the intercarpal, and we got here the condyloid between the metacarpophalangeal joint. So that is also important. These 6 kinds need to remember with their examples. And here we go to the largest synovial joint in our body, that we call that the knee joint, and it is a kind of hinge joint. It could also come as labeling of the bone. For example, this we got here the femur, and it is the distal end of the femur, which one is having the condyle here, okay, and medial and the lateral respectively. And we also have here the surface, what we call that patellar surface, where the patella is articulating. Here we got the patella. We got here the tibia bone. We got here the fibula bone. So after talking about the bone, that we can go to the cartilage, as we are having here the hyaline cartilage, articular cartilage, and except that we are having here the fibrocartilaginous portion, that what we call that meniscus, medial and the lateral respectively. We got here the quadriceps femoris tendon. We got here the patellar ligament, and we are having here the medial and the lateral collateral ligament. And we can also use the name of the bone as the medial side, it is attaching to the tibia, and the lateral side is attaching to the fibula. We got here in the middle here the anterior and the posterior cruciate ligament respectively. So pay attention that this kind of picture come at least the 10 labeling you need to make sure that you are doing. Next we are having here different kind of muscle fibers and the shape and their name. This you need to remember. It may come for labeling too, or simply as a question, and you need to give the example, that for example fusiform, what kind of muscle, parallel, what kind of convergent, what kind of muscle, unipinnate and bipinnate, multipinnate, and the circular respective example need to remember. Next we got here the simple structure, that when we see that here the muscle fiber, surrounding the muscle fiber the connective tissue, that we call that endomysium. When the muscle fiber make the bundle, that we call that fascicle. Around the fascicle we are having the sheet, connective tissue sheet, what we call that perimysium. And then around the whole muscle, that we call that epimysium. So these respective words are here. Also need to remember different kind of muscles due to their actions, and these are some vocabulary to remember for this. Thank you very much. Our first video is done. See you in the next video. Thank you.